Now, mycosis means fungal infections, and today we will be looking at the systemic infections or the fungal infections which affect the systems. Now, before going into the specific types of fungus, let us look at the classification of the fungus. I think you have already read in your plus 2 classification of the plant kingdom and the animal kingdom. The funguses are classified systematically into 4 groups, either into Ascomycetes or Zygomycetes or Basidiomycetes or fungi imperfect. Now keep in mind that is a systemic classification. That is a classification that is used to classify all the fungus that are found in the environment. Now not all funguses actually infect human body. Only a very selective fungi actually infect human body. Mostly there are 20 fungus which can cause human diseases. And from the diagnosis and management point of view, the classification of fungus is slightly different from the systemic classification. So in that point of view, we can actually classify the fungus into 4 types. The first would be the yeasts, the second would be yeast-like, the third would be molds, and finally dimorphic fungi. Now keep in mind this classification is totally based on the morphology of the fungus. Morphology means the appearance of the fungus. Now, as you know, the first type is called the yeast fungi. Yeast means they are single cellular fungus, hence they are called as yeast. Some fungus, they actually are almost yeast-like, but they may form some other appendages, hence they are called as yeast-like fungi. Very good example of yeast would be Cryptococcus, and an example of yeast-like fungi would be Candida. Furthermore, if you observe in the environment any food that has been kept outside, after a few days you will find the fungus starts growing, and the fungus almost appears like, the appearance is almost like tree-like. It has got a stem, it has got roots and some fruiting bodies. Those types of fungi are called as molds. Now the difference between the yeast-like and the molds would be, the molds are multicellular organisms, whereas the yeast or yeast-like are single cellular. However, there are some fungi which have been classified as dimorphic fungi. Now, what these fungus do, why they are called dimorphic fungi? Because they exist in both yeast-like morphology and also in mold-like morphology. So, what actually happens is that in the environmental conditions, that is around about 25 degrees centigrade, that is the environmental temperature, this fungi will show the morphology of the molds. However, when the spores of this fungi actually infect a human body, inside the human body, they remain in the yeast form. Hence, they are called as dimorphic fungi. Okay, clear? So, from diagnostic point of view, the morphology of the fungus plays a very important role for identification. Look at the picture on the left hand side. Under microscopy, the molds appear like slender, rod-like structures and interconnected. These rod-like structures are called as hyphae. Hyphae is basically the long, slender structures which connects each and every stems, so-called the stems of the fungi. And on the right-hand side, you can see that is the microscopic image of the yeast. If you observe, each and every cell is singular. The shape may be circular to oval. Now, coming to the topic that we are going to discuss, that is the systemic mycosis. Now, when we say systemic mycosis, what we actually mean? The mycosis or fungal infections can be divided into 2 types. There is the superficial mycosis and systemic mycosis. Again, systemic mycosis can be divided into subcutaneous mycosis or deep mycosis, depending on the location of the infection. Okay. So in deep mycosis, what would you understand by deep mycosis? There is the deep tissues and organs, if they are affected, we call it as deep mycosis. So systemic mycosis means a fungal infection which affects the internal organs. And in internal organs means any organ system including the cardiovascular system and the blood itself. So if a fungus is found within the blood, that is also the part of. Now the next part is, this is another very important point that you must understand about fungal infection. There are many numerous fungus in the environment. However, only a select few can actually cause human disease. And even then, you will find most of the adults are not infected with any sort of fungal disease. Because of our innate immune system is capable of deflecting the potential of the fungal infections. Hence, if any person has any sort of compromise in the functions of the immune system, that person would be more prone for fungal infections. Predominantly, it would be the innate and the cell-mediated part of the innate cell-mediated group of the immune system. If those two are compromised, then the fungal infections will be more commonly seen. Having said that, so who are the immune compromised? Undergone any kind of transplant surgery or will be undergoing transplant surgery. So before any kind of transplant, the patient's immune system is suppressed iatrogenically, and even after the transplantation, the immune system is suppressed. So this is the phase where the patient is very much vulnerable for various sorts of fungal infections. And even add to that extremes of age group, elderly and neonates, they are also vulnerable. And finally, among the general population, a very important category of the population which is susceptible for any sort of fungal infection are the patients who are diabetics. Keep in mind, diabetic patients have an altered immune system, mainly because of the hyperglycemia. So these people are also very much prone for fungal infections. Now, the fungal infections can be divided into two types of infections, either endemic infections or opportunistic infections. Now, what does the endemic word means? So basically, endemic means when a disease is present in a particular geographical area, that is called as endemic. So if a person stays there or travels to that particular geographical area, then the probability of getting that infection is higher. Hence, it is called as endemic. Or we can classify the disease into opportunistic infections. Why? Because endemic infections are all the fungal infections which can affect even in healthy individuals, whereas opportunistic fungal infections are infections which will affect the people who are immune compromised. Have you understood? For example, if we look at the fungus which causes endemic infections, these are the fungus. Histoplasma capsulatum causing histoplasmosis, Coccidioides, blastomyces and paracoccidioides, these are not present in India. They are present in the American continent. Hence, obviously as Indians, we will not get infections. Right? But we may get infected if somebody travels to those areas and they can get infected. Last is Talaromyces marnifi. It was previously called as Penicillium marnifi, which causes penicillinosis or Mycoses. So this is endemic, especially in the northeastern part of India, whereas the histoplasmosis are very commonly seen in the Gangetic belt in India. So as far as the endemic mycosis is concerned, we actually encounter two types of disease. One is histoplasmosis and another will be the Mycoses. The next type of infection would be the opportunistic infections. I have already told you, opportunistic fungal infections are those fungus which cause infections in immune compromised. Now, this would include Candida species, Aspergillus species, Cryptococcus, and Zygomycetes. Among them, Cryptococcus is the yeast, Candida is a yeast-like fungi, and Aspergillus and Zygomycetes are molds. Okay. So let us look at the fungal diseases. So this is a comprehensive list of the people who can be classified as immune compromised. I'm just going through. I think you'll be pretty much aware of all these conditions. One is advanced HIV infection, or patients who are suffering from any sort of systemic malignancies, neutropenia, transplant patients, any major surgical procedure being done, patient admitted in the ICU for a prolonged period of time, or iatrogenic immunosuppression with drugs or steroids, and extremes of age group. Okay, so this is a comprehensive list of the immunocompromised state. Now, what would be the presentation? Obviously, the organ or the organ system that is affected, the symptoms will be of that type. Generalized, we can say the patient will present with fever, cough, loss of appetite, cachexia. These will be the common symptoms. Other symptoms would involve depending on the part of the organ affected. For example, if the lungs are affected, the symptoms will come as cough, respiratory distress, chest pain, etc. If the bones are affected, then deep-seated pain, arthritis. If joints are affected, similarly, meningitis can happen if the central nervous system is affected. Okay. So this would be the comprehensive classification of the diseases. All systemic fungal infections we can classify endemic and opportunistic. And in endemic, I've already told you two very important: histoplasmosis and Mycoses. Now let us look at the opportunistic infections first. The first is most common disease which we encounter is called as Candidiasis. Now what is Candida? Candida is a yeast-like fungi, and it is also a part of the normal human microbiota. Normal human microbiota means on the human body there are many organisms, bacteria, fungi. They are present on the skin surface and also on the mucosal surfaces. So this fungi is actually present on the body itself. Now there lies the question that why does it flares up or causes an infection? You see, normally in the normal human microbiota, the fungus is present, but it cannot grow or multiply very rapidly because of the other bacteria that are present locally. So these bacteria will inhibit the growth of the fungus. Now suppose a patient is given a broad spectrum antibiotic for a prolonged period of time. What will happen? Most of the bacteria will be killed, and now the fungus will proliferate rapidly. Many a times, after the rapid proliferation, this fungi may penetrate from the mucous membrane into the bloodstream and entering into the bloodstream causing candidemia. And from the blood, it can reach any internal organ and organ system causing systemic infection. Understood? So this is called as Candida. Now these fungi is present everywhere in the body. The skin, the mucous membrane, the mouth, anal canal, vagina, everywhere in the body. Now if you look at the type of the manifestation of candidiasis, we can basically classify them into two types. The first type is called as cutaneous or superficial candidiasis. Superficial means where the growth is seen on the skin or mucosal surfaces. The other one would be the systemic candidiasis. No need to learn it by heart, just go through this. The first is, when we look at the cutaneous and the subcutaneous candidiasis, we have the first type is called as thrush. What is thrush? It is the overgrowth of candida. If it occurs in the mouth, we call it as oral thrush. If it occurs in the vagina, we call it as vaginal thrush. Similarly, if it affects the mouth, we call it as stomatitis. Stoma means opening, that is the mouth, hence stomatitis. Then we can also find this kind of infection in the intertriginous areas like axilla, groin, inframammary region in females. This infection can also occur on the nail bed itself. Very commonly seen, especially in hot and humid country like India, where if the people start wearing the footwear for a prolonged period of time, nail bed may get infected. Then we call it as onychomycosis. Onychomycosis means fungal infection of the nails. Next, esophagus. Oral thrush means it's the overgrowth in the mouth. The same overgrowth may spread into the esophageal epithelium. We call it as esophagitis. Or A very particular type of rash is seen, especially in infants. These infants, we usually put a diaper on them, right? And they will urinate and defecate on the diaper, and the diaper becomes moist, and the moist diaper remains in contact with the skin of the groin of the child for a prolonged period of time. Fungal growth can also be seen in the groin area of the infant. This is called as diaper rash. This is very common in India. And like vaginitis, Candida can also cause infection on the penis called as balanitis. So these would be the superficial infections. Now suppose from this superficial infection the fungus is able to penetrate and move into the bloodstream and then spread throughout the body. It can affect internal organs. Then we call it as a systemic infection. The systemic manifestation can be from esophagitis, intestinitis, any GI organ. In infants, suppose an infant, if they are given broad spectrum antibiotics, what will happen? Most of the bacteria in the gut will die and the candida will start to overgrow, and this will lead to diarrhea. It's not a systemic disease, however, it's a potential dangerous disease because there is always a chance of systemic manifestation of the disease. This is also an infant diarrhea. It can affect the lungs, bronchopulmonary candidiasis, or pyelonephritis. Pyelonephritis means infection of the kidney. Pyelo means pelvis, nephritis means infection of the kidney. Cystitis means bladder, that is urinary tract infection. Endocarditis, myocarditis, Candida endophthalmitis. Endophthalmitis means infection of the eyes. This can especially happen following candidemia. That means if the candida is there in the blood, it may reach into, obviously, through the arteries supplying in the eyes and may reach there and cause endophthalmitis. So it is very prudent if we do find a patient in whom on blood culture, if we find growth of candida, we have to examine the eyes of the patient to rule out endophthalmitis. Okay. It can cause meningitis, arthritis, osteomyelitis, literally any organ it can affect. Now I'll show you some pictures. Now this is the on the left hand side. What does the picture shows? If you look at very carefully, there is yellowish discoloration of the toenails because of the proliferation of the candida itself. It is called as onychomycosis. The next picture, if you can see, দেখতে পাচ্ছ তো কি, that is the popliteal region. Next, axilla, intertriginous candidiasis. Next, কি বলে এটাকে, oral thrush. This is basically an overgrowth of candida. This is inframammary region in a female patient, intertriginous candidiasis. Next, stomatitis, perioral. On the next picture, you can see the groin of a child. That is the diaper rash. This is very common. And if you take a clinical sample, that is a swab, from all these areas and look under the microscope, even on simple gram stain, we can find yeast. If you look closely, you can see these small oval shaped singular cells. These are the yeast. Okay. Along with that, there are small slender line like structures. Now in case of molds, we call them as hyphae, right? But this is a yeast-like fungi. This is not a mold. So this is called as pseudohyphae, not a true hyphae, hence called as pseudohyphae. One important feature of pseudohyphae is that presence of pseudohyphae indicates infection. That means, I've already told you Candida is present in the normal flora. In the normal flora, they're present mainly in the yeast form. But whenever it starts to grow rapidly and starts to infect the tissue, be the skin or mucous membrane, we can observe formation of pseudohyphae. Hence, it is always important if on microscopy we find yeast along with pseudohyphae, it should be mentioned. Now, let us look at some of the pictures of systemic infections. On the left hand side is a picture of pharynx, right? Now you can find white discoloration or whitish patches on the soft palate, uvula, and even in the posterior pharyngeal wall. Okay. Now this is not just a mere overgrowth of candida like a oral thrush that you saw in the tongue. Here you can find small discrete patches. Next, if we go further down and put an endoscope, we can find small patches along the. Another very important is this one. This is the speculum examination of a genital area of a female. If you look over here, the cervix can be seen and similar whitish patches is seen. So this is Candida cervicitis. This is also systemic infection. This is not a local infection. Similarly, we can observe similar infection in the vagina and the penis. Now, these are the physical features. What kind of investigation we can do to confirm it? কি করতে পারি? I think now you have understood if the patient has any signs and symptoms that is indicative of systemic infection, that patient has to be given systemic antifungal to control the disease. Understood? এটা বোঝা গেছে তো? যদি Candida pharyngitis হয়, esophagitis হয়, you have to give systemic fungal infection. Otherwise, what will happen? From the mucous membrane, it will spread into the deeper tissue. So, what kind of investigation that we can do? Obviously, I have shown you the pictures. We can examine the patient's body. We can do endoscopy also, and we can take the tissue sample, observe it under the microscope. We can go for what is called as a KOH mount. KOH mount means we put certain percentage of potassium hydroxide, which dissolves the human tissue, but it does not dissolve the fungal cells. So whatever that remains is the fungal cells. We can observe the fungus. A gram stain can also be done. We can identify the yeast. They will appear gram positive or purple in color. If we are suspecting of systemic infection, it is very much prudent to do a blood culture for fungus. Because at any point of time, the fungus can goes into the blood. So blood culture is very important along with other investigation, obviously the complete blood count, etc., and other investigation that are routinely done. The manifestation would be unexplained fever and leukocytosis, and even the patient may end up with sepsis. Antifungal agents has to be given very urgently because it is a medical emergency almost. Next, depending on the type of the organ system affected, we can classify them in this form, like endocarditis and cardiac device infections. In the endocarditis, when you were taught about endocarditis, what will be the source of the organism? Source কোথা থেকে হয়? Very commonly it is the endogenous source. The patient may have a vascular line, either a central line or a peripheral line. From there, the endogenous bacteria or the fungus may infect. Similarly, cardiac devices, any sort of device, maybe a prosthetic valve or a pacemaker, these can get infected. Central nervous system infection, especially meningitis, if eyes are infected, ocular infections. Similarly, GI, bone, soft tissue, respiratory infections, and genitourinary candida infection can also be seen. So this is a very gist of the candidiasis. So to summarize, candidiasis can be classified into two types. One is the superficial candidiasis, another will be the systemic candidiasis. Systemic candidiasis obviously will be depending on the type of the system affected. If the fungus is found in the blood, we call it as candidemia, and we have to treat the patient in the similar grounds as we are treating the patient with bacteremia and treating them for sepsis. Okay, next type of organisms we'll look at is called as Cryptococcus. Now, Cryptococcus is a true yeast. Now, as the name suggests, Cryptococcus means it is coccus means spherical in shape, and crypto means it is almost hidden. There are, as far as you people are concerned, only one species of Cryptococcus causes human infection. It is the Cryptococcus neoformans. Now, where does this Cryptococcus actually lives? It lives in the environment. Now, look at this picture. This is the yeast. It lives in the environment and it forms spores. These spores can infect the human body, predominantly through the inhalation route. It can. Two common associations are present with Cryptococcus in India. The first association with eucalyptus trees, and the second one would be bird droppings. The birds will eat seeds, etc., from the environment, and they will drop in their droppings the spores of the Cryptococcus is seen. So, whenever a person inhales the spores of the Cryptococcus, what will happen? It will reach into the lungs, and there the tissue macrophages will take up the Cryptococcus. Now, here lies very important factors. The first important factor is the immune system of the body. I have already classified this is a opportunistic fungal disease. That means in healthy human beings are able to get rid of the spore or degrade the spore in the lung itself. Okay, this is the reason why most of us will not get a cryptococcal infection. But suppose the patient is immune compromised, either permanent or a transient or a temporary basis. Whatever may be the basis, the patient is immune compromised, inhales the spore. Now the macrophage, they cannot degrade the spores of the fungus. This fungus will then go into the systemic circulation, causing cryptococcemia, that is presence of Cryptococcus in blood. And from there, it may reach into any organ. However, this fungus has a predilection for melanin. Hence, it may cross the blood-brain barrier into the cerebrospinal fluid, causing meningitis or meningoencephalitis. The other area it can go up is skin, causing cryptococcal ulcers of the skin. However, please remember, the spore initially affected the lungs. So, in immune compromised patients, the lungs will also be affected. This is called as pulmonary cryptococcosis. Have you understood? So, in immune compromised patient, the spore will reach the lungs and cause a disease over there called pulmonary cryptococcosis. Then the cryptococcus will spread into the blood, which we call it as cryptococcemia. From the blood, it may end up into the CSF through the blood-brain barrier, and if it reaches the CSF, it can cause meningoencephalitis. Meningitis with signs of encephalitis, hence it is called as meningoencephalitis, or it can cause cryptococcal ulcers of the skin. This is the various manifestation of Cryptococcus. Now, this meningitis or meningoencephalitis is generally subacute in nature. That means the onset is pretty much insidious. Many a times, the patient will present with forgetfulness, memory loss, and slowly delirious and into comatose state. Not an acute presentation like acute pyogenic meningitis. Incubation period is generally 2 to 4 weeks, and if we examine the cerebrospinal fluid, like in all cases of meningitis, we can find a phenomenon called as lymphocytic pleocytosis. কিছু বোঝা গেল লিম্ফোসাইটিক প্লিওসাইটোসিস মানে কি? Okay, in pyogenic meningitis, the number of neutrophils will rise. But in case of viral or tubercular meningitis, lymphocytes will increase. Over here, we can find lymphocyte outnumbering the neutrophils. Okay, so the picture will not at all resemble that of bacterial meningitis. Now, for diagnosis, what we can do if the patient presents with CNS symptoms, that is, presenting that of meningitis or meningoencephalitis. The best sample would be to draw a CSF sample from the patient, look for the various cellular parameters like the neutrophils, lymphocytes, protein, sugar, etc. And we can also look for the organism itself with a preparation called as India ink preparation, where we can look at the organism, or we can also test for the cryptococcal antigen. If the organism is present in the CSF, that means antigens of the fungus would also be seen. Hence, we can also test for the cryptococcal antigens. Even in the blood or serum, the cryptococcal antigen can be seen. And if we take a blood culture, we can also find growth of cryptococcus from the blood. Because cryptococcemia predates meningitis. Now look at this picture. On the left hand side, you can find very small cutaneous nodules that can be seen with cryptococcal nodules. Sometimes it may also ulcerate. The middle picture on the upper hand side will show you the lesions in the brain's tissue itself, signifying the encephalitic features. And over here, you can find the patchy lesions in this lung field. This is like the presentation of the pulmonary cryptococcosis. Many a times, especially in severely immunocompromised patients or patients in the stage of AIDS, we can find oral cryptococcal ulcers, especially in the soft palate, or we can also find lymphadenopathy. If you can see, this is the conlymph node. There is a cryptococcal lymphadenopathy. And suppose we take an aspirated sample from this lymph node, we can find cryptococcus like this on the aspirated sample. And I've already told you in case of CSF, we can do India ink staining. Now, what is this India ink staining? India ink is a negatively stained pigment. Negatively charged pigment. That means whatever the pigment material is present in the India ink, they have a negative charge. The fungus has a capsule. What is this capsule made up of? Polysaccharides. They are also negatively charged. Hence, the pigments, they would not get deposited on the capsule itself. So, if we put an India ink preparation, we can find the yeast along with a clear halo around. This halo is because of the capsule. So, this enables us for a very quick identification of this yeast, especially in the CSF samples. This is called as India ink preparation. Other diagnostic modality, I have already told you, we can look for the cryptococcal antigen in the CSF or on the blood. We can also go for a blood culture for cryptococcus. Obviously, it's a systemic mycosis. Antifungals has to be given for treatment. The next type of infections we will look at, the opportunistic infection we will look at, is called as aspergillosis. Now, if you take any food item, especially bread, and keep it outside for a few days, you will find black colored fungus growing over it. Very commonly, that is the Aspergillus niger. So, these aspergillus are present in the environment everywhere. And again, most of the people are not affected because they have a competent immune system. Now, aspergillus forms spores. I'll show you the picture. Now, this is a picture of the growth of aspergillus on a petri dish containing a medium. Now, if you look on this picture, you will find the top layer is almost like a powdery substance. This powdery substance is nothing but the spores of the aspergillus. Now, if we take a small portion of this growth and observe it under the microscope on a LPCB mount or lactophenol cotton blue mount, you can see these are the sacs. These are called ascus or sacs. And from there you can find many small dotted structures. These are the spores. Now these spores are present in the environment. Normally what happens is we inhale the spores and our body is able to get rid of the spores. But what happens in immune compromised patients? Look over here. In patients with or individuals with intact immune system, spores enter through the respiratory route into the pulmonary bed. The neutrophils will take up the spore. Macrophage will come over here and will destroy the spore. Now, if the patient has a compromised immune system, the macrophage and the neutrophil would not be able to destroy the spore. Now, this spore is getting a very good environment to grow in the human body, and it will start to grow and form this kind of structure that is called as a hyphal structure, and there it will start to proliferate. It may proliferate in a single area or throughout the lung. Then we call it as pulmonary aspergillosis. Now, a feature of aspergillus is that they can penetrate into the blood vessels. This is called angio-invasive property. Angio means vessels, invasion means they can invade into the vessels. And if they can invade into the vessel, what will happen? Patient will bleed. So that is the formation of pulmonary aspergillosis. The other manifestations like this, if you look at the radiological picture over here in the CT scan, you can find this is the particular area which is affected. There are many signs like halo sign, reverse halo sign, crescent sign, these can be seen. Another manifestation can also be seen, especially in patients who have a structural damage to the lung tissue previously. For example, suppose a patient has already had a pulmonary tuberculosis, and because of the pulmonary tuberculosis, there is a structural damage. Thereafter, the aspergillus infection occurs. So many times, what can happen is that suppose this is the lung, and there is a cavity because of pulmonary tuberculosis. The spores may enter over here, and they may go. But because of the previous cavitary lesion because of tuberculosis, it cannot penetrate the granulomatous tissue because in the pre-existing cavity. So the fungus grows into the hyphal form and forms a ball. This is called as fungal ball. So as long as it is restricted within the cavity, it will not actually be very harmful. And if the lungs are intact, it will invade into the lung tissue, forming pulmonary aspergillosis. Another area the aspergillosis can occur is the sinuses. Like the lungs, the sinuses are also filled with air during respiration. If the spore is able to get into the paranasal sinuses, similarly, like that of lung, it may cause sinusitis. And it may also form fungal ball within the sinuses, especially the large sinus like maxillary sinus. Along with that, other invasive disease that can occur is that from the lungs, it may spread into the blood, and from there it can affect any internal organ like kidneys or liver, any organ. Another very important type of infection that is seen is called as fungal keratitis. Keratitis means infection of the cornea. Now, India is predominantly an agrarian economy. People are involved with farming and be agriculture or food farming or cattle rearing. So, the food grains, the cattle, aspergillus is present everywhere. Any sort of injury to the eye on the cornea may lead to inoculation of a fungal spore on the cornea, and from there ulceration and infection can occur. This is called as fungal keratitis. The next type of aspergillus manifestation can be seen is called as ABPA or allergic bronchopulmonary aspergillosis. So this is basically an allergic manifestation to the fungal antigen. That is the Aspergillus antigen. The patient will have various kind of allergic manifestation from bronchial asthma to raised IgE levels, etc. And last but not the least is the presence of toxins of Aspergillus. Very commonly, aflatoxin can be seen, and this toxicosis can be seen especially when people consume grains which are contaminated with Aspergillus. Say wheat or rice which have been kept for a prolonged period of time, Aspergillus may grow over there, and when people boil those grains and consume them, the toxins will be absorbed, and then toxicosis can be seen. Now these manifestations are called as mycotoxicosis. Myco means fungus and toxicosis means intoxication. Okay. The next type of opportunistic infection, I've already told you, although it is endemic, but it is especially in the northeastern states of India, but it is generally seen in patients with AIDS, in the AIDS stage. It is also an AIDS defining condition. So the route of infection is same. Spores of the fungus are present in the environment. People inhale them. They cannot get rid of the spores. They germinate, spreads throughout the body, from lungs to the blood. Now, if you look over the picture over here, you can find multiple nodules on the face. These are the penicillium nodules, like over there, and we can also see this is the growth of the fungus in the laboratory, and on microscopy you can find this fungus where these almost resembles like the skeleton of the human hand. The last but very important opportunistic fungal infection is called as zygomycosis. Now, during the COVID pandemic, if you have heard, there was repeated cases of black fungus. Have you heard about it? So this is the fungus which causes black fungus. Now keep in mind, zygomycosis is not a single fungus, but a group of fungus. They share the same commonality, hence they are grouped as zygomyces. There are many genus of zygomyces. For you people, please remember at least three: Rhizopus, Mucor, Rhizomucor. Okay? Rhizopus, Mucor, Rhizomucor. The infection is again similar to that of aspergillosis by spores. Commonly affected nose, that is the sinuses, and the lungs. Like aspergillus, they spread rapidly, but one very difference is they can cause great tissue destruction, and they have a higher propensity to invade into the blood vessels, hence causing bleeding, local bleeding. When this blood coagulates, it appears as black in color, hence they are called as black fungus. The most common presentation would be seen with rhinosinusitis, that is the infection of the nose and sinuses, and pulmonary aspergillosis. Now look over these pictures. On the left hand side, you can find on the soft palate of the patient there is a black color ulcer. There is an ulcer with a black ulcer bed. That is the black color of zygomycosis infection. In this picture, if you see, this is the infection of the nose. This is the picture where you can see the lungs are grossly affected. There is the pulmonary aspergillosis. On H&E staining, we can find long, slender structures, but slightly thicker and wider as compared to the aspergillus. Hence, they are also described as broad hyphae. In aspergillus, we have thin hyphae, they have broad hyphae. Over here, you can find post rhinosinusitis, there is orbital cellulitis like this, and it may even invade from the sinuses into the frontal lobe of the brain, causing brain effect collectible. Cerebral zygomycosis. That's a very disastrous situation, and most of the time They are not very much responsive to the antifungal agents, and surgery is the mainstay of the treatment. Now, coming to dimorphic fungi or the endemic fungus, I will discuss only histoplasmosis because coccidioidomycosis, paracoccidioidomycosis, and they do not actually happen in India. If you are interested enough, you can go and read it. But what you must know is histoplasmosis. It is also called as caves disease because initially it was found this disease were commonly seen in spelunkers. Spelunkers mean people who go into the caves. So what it was initially thought of that bat droppings have histoplasmosis. So when people venture into the caves, they inhale the spores of the fungus and get infected. But in India, the spores can be associated with bird droppings, especially pigeons. So whatever it may be, depending on the geographical location, a bat or a pigeon droppings, they will drop, and this hyphal form. Remember, this is a dimorphic form. So in the environment, they will be in the hyphal form. The mold form will grow on the surface of the soil. Now, little bit of epidemiology in the Gangetic belt, especially after the rainy season, after the floods, most of the soil is covered with dead and decaying materials. So whatever spores that were present on the top of the soil, they will start now growing. They will start to grow in the mold form. And when their growth is complete, they will again form the spores. And this is the time, especially in the post rainy season, when the weather dries up slightly, these spores are liberated in the air. People will inhale the spores, and then if the patient is slightly immune compromised, and sometimes even in healthy people, it can cause infection. The spores will be inhaled, causing pulmonary histoplasmosis. Affects the lung, almost the same route, and will cause pulmonary histoplasmosis. From there, it may reach into the blood and may end up anywhere in the body. It can be seen in the reticuloendothelial cells like bone marrow, liver, spleen, sometimes even in adrenal glands, causing adrenal histoplasmosis. Okay, but the predominant presentation is that of pulmonary histoplasmosis. Now, if we look at the pulmonary histoplasmosis, we'll find an infection or the manifestation that almost resembles tuberculosis. Why? Now, what is the difference between a bacterial infection of the lung and a tubercular infection of the lung? Anyone? Pathology তো পড়ানো হয়ে যেত tubercular infection কি হয়? Granuloma formation, that is a granulomatous infection. So histoplasma will also end up having a granulomatous manifestation. Now, why I am telling you this? When you will be observing the patients, the patient may have features like of tuberculosis. That is long-standing cough, expectoration, low-grade fever, and on say an X-ray or a radiological imaging, you may find a consolidation or a cavity in the lungs. And obviously, you will be thinking about pulmonary tuberculosis. But if you see the patient is from the Gangetic belt of India, always keep histoplasmosis in your differentials. Because if you do not go for definitive diagnosis, what will happen is you will end up treating a patient with histoplasmosis with anti-tubercular drug and you will lose the patient. Okay. Now, an interesting phase of diagnosis of histoplasmosis is that it's a dimorphic fungi. So, in the laboratory, what we do is we take the clinical sample. Whatever the organ affected, if the lungs are affected, we can take the sputum sample or a bronchoalveolar lavage or a lung biopsy sample. If it affects the bone marrow, we can take a bone marrow sample, etc., etc. And on those clinical samples, we will observe yeasts. We can go for a GMS staining or even an H&E staining, whatever may be the staining method. Predominant observation would be that of the yeast. And when we inoculate the clinical sample on the culture media and incubate at 37 degrees centigrade, on the culture plate also we will obtain yeast. Now, because it's a dimorphic fungi, one of the way we can confirm the diagnosis is by inoculating the same yeast, not at 37 degrees centigrade now, but at 25 degrees centigrade. Then we can observe the same yeast will change into the mold form. Okay, so this is the in vitro change of the morphology. By eliciting the dimorphism of this fungus, we can make a diagnosis. And as far as the observation is concerned, look at this image. This is the image of the yeast, the fruiting body of the mold form. And over here, if you find, this is the yeast. Basically, circular body yeast can be seen. But in the mold form, you can find the fruiting body is almost like a sunflower-like appearance. অনেক রকম description আছে. Sunflower-like appearance. You can find a large circular structure with spikes from both ends. So, to sum up, for diagnosis of systemic mycosis, what we can do? We can take the clinical sample based on the organ system affected. It could be the blood, it could be the CSF, the sputum, bronchial lavage, pus, or tissue biopsy. Microscopic examination we can do, or either we can get a potassium hydroxide examination or an indaying preparation for Cryptococcus, or we can go for calcofluor white. CFW is calcofluor white. It's a fluorescent stain which stains the fungal elements but does not stain the human cells. So that can enable us for direct examination of the fungus. Furthermore, we can go for particular stain. It could be a gram stain, it could be a GMS stain or gomodymethamine staining, or a PAS stain, that is the periodic acid shift staining, or mucicalmine staining, or Mason-Fontana staining, depending on the type of the organism that is expected. Furthermore, we can also go for the culture and demonstration of other methods. So these are some of the images, like in Histoplasma capsulatum, HNE staining, you can see the histocyte, a large histocyte which contains a yeast cell. Now, as far as you people are concerned, whenever if you encounter any kind of fungal disease, as far as culture, just utter the name SDA agar, SDA, Sabouraud Dextrose Agar. There are many different kinds of culture media on which culture can be done. That is beyond what you can comprehend. Just remember one media, that is Sabouraud Dextrose Agar. Okay, and all fungus are incubated at 25 degrees centigrade, except in case of dimorphic fungi and yeast. For yeast, we incubate at 37 degrees centigrade, and in case of dimorphic fungi, we incubate at 37 and 25 both. বোঝা গেছে? যদি জিজ্ঞেস করা হয় যে পরীক্ষার সময় কিভাবে কালচার করবে, কি বললাম? yeast-like mold আর dimorphic fungi. মোল্ডের জন্য 25 ডিগ্রি সেন্টিগ্রেড, yeast আর yeast-like এর জন্য 37 ডিগ্রি সেন্টিগ্রেড, আর dimorphic fungi এর জন্য দুটো। মনে থাকবে? কালচার মিডিয়া কি হবে? HDR, ঠিক আছে? Healthy individuals. Opportunistic means in immunocompromised patients. Common immunocompromised state কি হয়? AIDS, malignancies, iatrogenic মানে any sort of treatment, chemotherapeutic, radiotherapeutic, বা steroid therapy, whatever it may be, are transplant patients and extremes of age group and diabetics. এই 6-7টা conditions. What are the opportunistic infections? yeast-এর মধ্যে opportunistic infection কি? Cryptococcus. Predominantly কি করে? Pulmonary Cryptococcosis, ব্লাডে যায়, তাহলে Cryptococcemia, CNS infection, meningoencephalitis, আর cutaneous ulcers. yeast-like ফাঙ্গাসের মধ্যে কি হচ্ছে? ক্যান্ডিডা কি ইনফেকশন করে? টু টাইপস, সুপারফিশিয়াল, সিস্টেমিক। সুপারফিশিয়াল কি হয়? একদম মুখ থেকে পা পর্যন্ত ভাবো, মুখে কি করে? স্টোমাটাইটিস, ওরাল থ্রাশ, তারপর ইন্টেস্টিনে ওভারগ্রোথ করলে কি হবে? ইনফ্যান্টাইল ডায়রিয়া, তারপরে ভ্যাজাইনাইটিস, ব্যালানাইটিস, অনাইকোমাইকোসিস। সুপারফিশিয়াল না, চোখ সবসময় ডিপ, চোখ মানে এন্ডোপথ্যালমাইটিস, চোখে যাবে কি করে? ব্লাড থেকে যাবে। যদি সিস্টেমিক ইনফেকশন বলা হয় কি কি হবে? ইসোফেজাইটিস, ইন্টারনাল জিআই, জিও, দ্যাট ইজ সিস্টাইটিস, পাইলোনেফ্রাইটিস, any organ, blood, eye, meningitis, all are systemic candida infection. ঠিক আছে? তাহলে ইস্ট হলো, ইস্ট লাইক হলো। মোল্ডস এর মধ্যে অপরচুনিস্টিক ইনফেকশনের মধ্যে কমনলি কি হয়? অ্যাসপারজিলাস অ্যান্ড জাইগোমাইসিস। অ্যাসপারজিলাস প্রিডমিনেন্টলি কি কি করে? পালমোনারি অ্যাসপারজিলোসিস আর সাইনাস ইনফেকশন করতে পারে। তাহলে যা লাংসে করতে পারে সাইনাসে করতে পারে। তাহলে পালমোনারি অ্যাসপারজিলোসিস, সাইনাসে ইনফেকশন করতে পারে। আর কি করতে পারে? কি বললাম? ক্যাভিটারি লিশন থাকলে একটা বল বানিয়ে দিতে, যেটাকে বলা ফাঙ্গাল বল। এবিপিএ করতে পারে, অ্যালার্জিক ব্রঙ্কো পালমোনারি অ্যাসপারজিলোসিস। আর লাস্টে অ্যাসপারজিলোসের মধ্যে মনে রাখবে দ্যাট ইজ দ্য মাইকোটক্সিনস, মাইকোটক্সিকোসিস করতে পারে। ঠিক আছে? জাইগোমাইসিটিস মানে হচ্ছে ব্ল্যাক ফাঙ্গাস। কমনলি স্পিসিস কি? রাইজোপাস, মিউকার, রাইজোমিউকার। কমনলি কোথায় কোথায় এফেক্ট করে? লাংসে আর সাইনাসেস, রাইনোসাইনোসাইটিস অ্যান্ড পালমোনারি জাইগোমাইসিটিস। এটা ছাড়াও এনি ডিপ অর্গানকে এফেক্ট করতে পারে, প্রিডমিনেন্টলি এগুলো। ঠিক আছে? নেক্সট হচ্ছে এন্ডেমিকের মধ্যে দুটো ইন্ডিয়াতে, হিস্টোপ্লাজমোসিস আর পেনিসিলোনেসিস বা ট্যালোরোমাইসিস। ট্যালোরোমাইসিস জেনারেলি নর্থ ইস্টে পাওয়া যায়, ম্যানিফেস্টেশন আর পালমোনারি লিজন, আর ক্লাসিক্যালি পেনিসিলিয়ান ইনফেকশনে ফেশিয়াল লিজনস বা স্কিন লিজনস বেশি করে পাওয়া যায়। হিস্টোপ্লাজমা কোথায় হয়? গ্যাঙ্গেটিক বেল্টে হয়, প্রিডমিনেন্টলি লাং ইনফেকশন করে, অ্যান্ড ইট রিজেম্বলস টিউবারকুলোসিস বিকজ গ্রানুলোমাটাস ইনফেকশন। ঠিক আছে? বোঝা গেছে?